Well, I will say that the role of forensic expert is essential in the investigation and fighting against torture. It's essential because his mission will be to access all the possible lesions and signs of abuse, even in the absence of specific complaints or allegations. It will be essential to document these signs of abuse. It will be essential to make an interpretation, because not always what you see in an alleged victim of torture corresponds to torture. Sometimes you have things that are lesions that are self-inflicted. Sometimes they depend from routine medical practices or from ritual behaviors. So it's also essential to make the disclosure of this kind of situations. So I think that the presence today of a forensic expert in every mission that tries to assess, to investigate torture is a main factor. And you know that today many reports presented, for example, by the United Nations Special Rapporteur to the United Nations always stress very well the fundamental role of having a forensic expert in the team. Another thing is that it's not always easy to perform these kinds of missions, because there are, of course, many difficulties. Of course, in all these kinds of situations, there are things that you have to take care and that you have to prevent. In these kind of circumstances, you always have to maintain, and it's always a challenge to maintain impartiality, to maintain prudence, to maintain truthfulness, to maintain independence, to maintain objectivity. But of course, depending on the situations, and especially on the circumstances on the field, there are other challenges. For example, not always is easy to conduct a private interview or a private examination. Not always it's easy to obtain photos to document what you have seen. Not always it's easy to access all the detainees that you want to access. Not always it's easy to make some complementary examinations that sometimes will be absolutely fundamental for a correct interpretation. For example, to do an X-rays, to do some lab analysis, sometimes they can be fundamental for a correct interpretation, and not always you have the access to these kind of things. And of course, there is always the challenge of knowing that every day more torturers try to conceal their actions, and they adopt methods that leave no signs. So this is another challenge, to try to make a correct interpretation when you know that many times you will not have physical evidences, and especially when you know that also the interpretation of psychological sequelae can be difficult, because sometimes you don't know exactly if they are due just to the prison conditions, or even from the past of the victim, or if they are really due to the situations of torture. So this can also be quite difficult to interpret. And of course, there are many other challenges. For example, if a continued risk exists for the victim or their family, that's another challenge, is to do things without creating new risks for the victims or for their families. So it depends from the situations and from the circumstances. The main challenges can vary depending on the situation and on the circumstances. I remember again one situation in South America, in one country, where the majority of the victims present shots in the legs. And it was always alleged by the police and by the government that this was due to tentatives of escape, and that the guards should be praised for shooting them on the legs and not killing them, and that we should not say these things. But the truth is that the forensic examination really showed that all the shoots were from the inside to the outside, sometimes 3 or more shoots in the same leg. And the fundamental examination, the forensic examination, was fundamental to prove that these allegations did not correspond to truth, and that what the guards were saying and what the government was saying did not correspond to the truth, and that these kind of sequelae were really from torture.